So part of my deployment that I had under EMAC, which is the Emergency Management Assistance Compact, was to go to the U.S. Virgin Islands to assist the VI, Department of Health, with a number of areas following Hurricanes Irma and Hurricane Maria that impacted all three islands. As you know, the U.S. Virgin Islands consists of St. Croix, St. Thomas, and St. John. So part of the team that I worked with was to develop a phase process where we could bring in some temporary operating rooms because the operating rooms were impacted at Juan Luis Hospital, which is the hospital in St. Croix. We worked on a number of projects to look at a temporary modular hospital that could be put in the parking lot at the hospital. Part of the challenges there is that the hospital has lost about 50% of their employees. They lost a lot of the services. They have a almost 100% new administration team since the storm. So the real problem is that each of these islands has one hospital, as I said, in St. Thomas and St. Croix. In the event that your services are needed, or services are needed that are beyond their capacity, let's say that you need an operation, and right now we don't have operating rooms to provide a lot of the services on island, then you have to be flown off the island. Well, it's not just riding in an ambulance to the next community like we do here in the States. It's having to get on an air ambulance, sometimes at a cost as much as $30,000 to fly off island so that you can get that care. Public health employees in that area right now have a tent, shelters that we set up that are air-conditioned shelters, so they would have a little cooler place to work, as well as one that may not have some of the mold. There's a lot of work still to be done and a lot of good committed people down there working on it, and I was just really proud to be able to be part of that process for 44 days during my deployment down there.